Every few minutes, another older adult is told they have dementia. By the time you finish watching this video, more families will receive that life-changing diagnosis. But age is not always the reason. Sometimes the real cause is sitting quietly in a medicine cabinet. A medication that was considered safe and taken exactly as directed. Throughout my years in medical practice, I've seen the same story unfold again and again. Someone who has always been sharp begins forgetting names, appointments, or even familiar routes they've driven for decades. Family members often assume it's simply part of getting older. Yet, in some cases, the true culprit is a medication nobody thought to question. Recent research continues to reveal an uncomfortable truth. Certain commonly used drugs may significantly affect memory and cognitive function in a surprisingly short period of time. Today, we're counting down 9 medications most strongly associated with accelerated memory decline in older adults. We'll begin with the lesser-known offenders and work our way to the one I consider the most concerning. Pay close attention to number 3. It is prescribed to millions of people for a condition that seems completely harmless. Yet it may be affecting the memory centers of the brain without any obvious warning signs. Let's begin. Medication number 9. At number 9 is a medication found in countless homes across the country. It's diphenhydramine, commonly sold under the brand name Benadryl. People take it for allergies, colds, and even as a sleep aid. Because it's available without a prescription, many assume it's completely harmless. However, there's an important detail most people never hear. Diphenhydramine belongs to a group of medications called anticholinergics. These drugs block acetylcholine, a brain chemical that plays a critical role in forming new memories and maintaining mental alertness. As we age, natural acetylcholine levels decline. That means older brains become much more vulnerable to medications that interfere with this system. One of the areas most affected is the hippocampus, the region responsible for creating and storing new memories. Over the years, I've seen many patients use nighttime antihistamines for long periods without realizing they may be contributing to increasing mental fog and forgetfulness. Research has repeatedly shown a connection between long-term anticholinergic use and a significantly greater risk of cognitive decline and dementia. This is why it's important to check the labels of allergy medications, nighttime cold remedies, and sleep aids. Many contain diphenhydramine or similar ingredients under different brand names. Fortunately, newer antihistamines are available that have far less impact on the brain and are generally considered safer for long-term use. Of course, never stop or change any medication without discussing it with your healthcare provider first. That brings us to number 9. Now, let's move on to medication number 8. Coming in at number 8 is a medication your stomach may appreciate, but your brain might not. We're talking about proton pump inhibitors, commonly known as PPIs. Examples include omeprazole, Prilosec, and esomeprazole, Nexium, 2 of the most frequently used treatments for acid reflux, heartburn, and chronic indigestion. For many people, these medications become part of their daily routine. They work so well that once symptoms disappear, it's easy to stay on them for years. But here's what often gets overlooked. Your stomach acid isn't just there to digest food. It also helps your body absorb critical nutrients, especially vitamin B12, which plays a major role in nerve health and brain function. When stomach acid remains suppressed for long periods, B12 levels can gradually decline. Magnesium and calcium absorption may also suffer. Over time, these deficiencies can contribute to confusion, forgetfulness, poor concentration, and symptoms that may resemble early cognitive decline. Some researchers have also suggested a possible connection between long-term PPI use and increased accumulation of proteins associated with Alzheimer's disease, although the evidence remains under investigation. If you've been taking a PPI every day for years, it may be worth discussing with your doctor whether a lower dose, a shorter treatment schedule, or an alternative approach could be appropriate. The goal isn't necessarily to stop treatment. The goal is to make sure you're taking the lowest effective dose for the shortest amount of time necessary. Now let's move to number 7. This next medication is prescribed for a problem many people rarely talk about openly. Number 7 is oxybutynin, commonly prescribed for overactive bladder symptoms. For individuals struggling with sudden urgency or frequent trips to the bathroom, the medication can provide meaningful relief. The problem is how it works. Oxybutynin blocks acetylcholine, the same memory-related chemical affected by many of the medications already discussed. Unlike some drugs that have only limited effects on the brain, oxybutynin crosses into brain tissue quite easily. That means the same mechanism helping control bladder activity may also interfere with memory formation and mental clarity. Studies involving older adults have repeatedly linked long-term use of strong anticholinergic medications to significantly higher rates of cognitive decline and dementia. What makes this especially concerning is that many people never connect their increasing forgetfulness to the medication itself. They assume it's simply aging. Missed appointments become normal, keys are misplaced more often, conversations become harder to follow, and nobody thinks to review the prescription list. The good news is that newer bladder medications are available that work through different pathways and may carry a lower cognitive risk. If you're taking oxybutynin and have noticed changes in memory or concentration, it's worth bringing up with your healthcare provider. Now, let's move on to number 6. This next medication may surprise you because it's one of the most prescribed drug classes in the world. Number 6 is statins. Medications such as atorvastatin and simvastatin are widely used to lower cholesterol and reduce the risk of heart attacks and strokes. For many people, these medications provide important cardiovascular protection. But there is another side of the conversation that deserves attention. Your brain contains a substantial amount of cholesterol and relies on it to maintain healthy nerve connections and protective coverings around nerve cells. Some researchers have questioned whether certain statins, particularly those that enter brain tissue more easily, could contribute to memory complaints in a subset of patients. While the overall scientific evidence remains mixed, some older adults report episodes of forgetfulness, mental fog, or difficulty concentrating after long-term statin use. Not all statins behave the same way. Certain options appear less likely to cross into the brain and may be preferable for individuals experiencing cognitive side effects. This does not mean you should stop taking a statin. For many people, the cardiovascular benefits clearly outweigh the risks. However, if you've noticed changes in memory after starting treatment, it's a conversation worth having with your physician. Never make adjustments without medical guidance. Next, we arrive at number 5. At number 5, we come to a group of medications that millions of people rely on for anxiety and sleep. These are benzodiazepines. Common examples include Xanax, Valium, and Ativan. For someone struggling with panic attacks, constant worry, or sleepless nights, these medications can feel like a lifesaver. Within a short time, anxiety settles down, racing thoughts slow, and sleep becomes easier. But the brain often pays a price for that relief. Benzodiazepines work by enhancing GABA, a chemical messenger that quiets activity throughout the nervous system. While this calming effect can be helpful in the short term, prolonged use may gradually affect memory, attention, and learning. Research has repeatedly linked long-term benzodiazepine use with a greater likelihood of cognitive decline in older adults. Many users describe feeling mentally slower. They may struggle to recall recent conversations, process information as quickly as before, or stay focused on tasks that once felt easy. One of the biggest concerns is that the brain can become dependent on these medications. When people try to stop suddenly, anxiety and insomnia often return with even greater intensity. That's why abrupt discontinuation can be dangerous. If you've been taking a benzodiazepine regularly, any reduction should be done carefully under medical supervision. Fortunately, there are alternative treatments available for anxiety and insomnia that may carry fewer long-term cognitive concerns. Now, let's move to number 4. Number 4 is a medication that wears many different hats. It's often prescribed for depression, nerve pain, chronic headaches, and sleep problems. The medication is amitriptyline. Because it can help with several conditions at once, many people stay on it for years without ever questioning whether it might affect memory. The concern lies in its powerful anticholinergic effects. Like several medications already mentioned, amitriptyline interferes with acetylcholine, one of the brain's most important chemicals for memory formation and communication between nerve cells. The longer the exposure, the greater the potential burden on cognitive function. Studies involving older adults have found that prolonged use of strong anticholinergic medications is associated with a significantly higher risk of developing dementia later in life. What's troubling is how gradually these changes can occur. People may begin forgetting words, concentration becomes more difficult, mental sharpness slowly fades. Because the decline happens over years rather than weeks, many assume it's simply part of aging. In reality, medication may be contributing to the problem. Today, there are often newer treatment options available for nerve pain, depression, and sleep disorders that may place less strain on memory-related pathways. If amitriptyline is part of your routine, it may be worth discussing alternatives with your healthcare provider. Now we arrive at the medication I told you to watch closely. Number 3 is a medication prescribed to millions of people for depression and anxiety. It's paroxetine, commonly known by the brand name Paxil. At first glance, it appears to be a modern antidepressant similar to many others in its class. However, paroxetine has one important characteristic that makes it different. Unlike most SSRIs, it has noticeable anticholinergic activity. That means it can interfere with the same acetylcholine system we've been discussing throughout this video. This distinction matters because acetylcholine is critical for memory, attention, and cognitive performance. Several studies examining older adults have found that paroxetine users may experience greater difficulties with short-term memory, word recall, and concentration compared with individuals taking other antidepressants. The irony is difficult to ignore. A medication intended to improve emotional well-being may, in some cases, contribute to cognitive problems over time. Because of these concerns, many geriatric specialists prefer alternative SSRIs for older adults whenever possible. Medications such as sertraline and escitalopram are often viewed as more brain-friendly options because they have much less impact on acetylcholine. If you're currently taking paroxetine, don't stop suddenly. Instead, talk with your doctor about whether another treatment may be more appropriate for your situation. And now, we're entering the final 2 positions on this list, the medications that concern me the most. Medication number 2. Number 2 is a category of medications that many people take without even realizing what type of drug they're using. These are antipsychotic medications. Common examples include Seroquel, Risperdal, and Zyprexa. Originally, these medications were developed to treat serious psychiatric disorders, such as schizophrenia and bipolar disorder. Today, however, they are frequently prescribed for a much wider range of issues, especially among older adults. In some cases, they are used to manage sleep problems, agitation, confusion, or behavioral symptoms associated with dementia. And that's where concerns begin. These medications work by suppressing dopamine, a neurotransmitter involved in motivation, focus, planning, learning, and memory. When dopamine activity is significantly reduced, mental processing can become slower, reactions may feel delayed, concentration weakens. Some people appear emotionally flat or disconnected from the world around them. Research has linked long-term antipsychotic use in older adults to accelerated cognitive decline, particularly when these medications are prescribed primarily to control behavior rather than treat a severe psychiatric condition. They have also been associated with increased risks of falls, hospitalization, stroke, and other serious complications in seniors. What troubles many specialists is that families are not always fully informed about these risks. Instead, they watch their loved one become increasingly withdrawn and assume the disease itself is progressing. If you or someone you care about is taking an antipsychotic medication, ask an important question. Why was this medication started in the first place? And is it still necessary today? Sometimes the answer is yes. But sometimes a medication that was intended to be temporary quietly becomes permanent without anyone revisiting the decision. Now we come to the final position on this list. The number 1 threat isn't a single medication. It's something far more common and far more dangerous. Number 1 is anticholinergic overload. In other words, multiple medications working together to impair memory at the same time. Most people expect there to be one worst drug. The truth is often much more complicated. A senior might take an antihistamine for sleep, a bladder medication during the day, a medication for nerve pain at night. Individually, each drug may cause only mild effects, but together they create a cumulative burden on the brain. Every one of those medications may be blocking acetylcholine from a different angle. Over months and years, the impact can become substantial. Research has shown that individuals with the highest anticholinergic burden face dramatically greater risks of cognitive decline and dementia compared with those taking little or none. The frightening part is that most people never realize it's happening. Nobody explains which medications are anticholinergic. Nobody adds up the total burden. Nobody connects the increasing forgetfulness to the growing medication list. Instead, the symptoms are blamed on aging. But here's the encouraging news. Medication-related cognitive decline is often one of the most reversible causes of memory problems. When problematic medications are identified early and adjusted appropriately, many people experience meaningful improvements in memory, focus, and mental clarity. That's why a complete medication review may be one of the most valuable conversations an older adult can have. Review every prescription. Review every over-the-counter medication. Review every supplement. Look at the entire picture, not just individual drugs. Sometimes the solution isn't adding another pill. Sometimes it's removing the right one. If today's video taught you something new, don't keep it to yourself. Share it with a friend, spouse, parent, or anyone who takes medications regularly. One simple conversation could help someone recognize a problem before serious damage occurs. And now, I'd like to hear from you. How many medications do you currently take each day? Have you ever noticed brain fog, memory problems, or increased forgetfulness after starting a new prescription? Leave a comment below and let me know. Your experience may help someone else connect the dots. And before you go, remember this. The body often gives warning signs long before a major problem appears. Many of those signs are easy to miss if you don't know where to look. In the next video, we'll discuss 4 surprising changes that can appear in your fingernails and what they may reveal about your overall health. Stay healthy, stay informed, and I'll see you in the next video.